Welcome to the Flexible Fasting Show, where we share the truth with love so you can be all God created you to be. Today I am joined by multiple guests. We are really excited to have some cancer survivors on the show today. So obviously I have Mr. Flexible Fasting joining me here, Sam. And to my left I have my beautiful mother, who is our family researcher and has a lot of exciting things to share, I'm sure. And my dad, who is a kidney cancer survivor and an engineer, and my beautiful sister, who is a breast cancer survivor and a nurse practitioner, and her sweet little squishy monster, her little baby here, who does not like to be separated from mama yet. So he's going to hang out with us while we talk today. So the reason I wanted to have all you guys on the show is because I kind of want to have a little powwow on basically improving our health and our immune system. So you're both cancer survivors. You've done a ton of research on cancer cures, things to improve your health and your immune system and your body and prevent cancer and all of those things. And I just feel like people need to know what you have learned, because wouldn't it be great if we all didn't have to have cancer to really start figuring out and advocating for our own health and wellness and learn those things before we get to that point, you know? Because we as a family, like all of us, have been affected through cancer diagnosis. And I know a lot of our listeners, I'm sure, know people who have cancer, loved ones, and you've all been affected by it. And it's something that you don't want to have to deal with. So what can we do to improve our health? What can we do to prevent that? And what can we do to better our children's lives so that they don't have to deal with those things either? So it's just, you guys have learned a lot. You've changed a lot of things since your diagnosis, and you're now both thankfully cancer-free. Praise God. But yeah, I just want to dive in and just talk about, like, you know, what your life looked like before you had cancer and now afterwards. Like, what are you doing now to prevent cancer now, or just improve your health in general? Like, how are you feeling about your health now?
Go ahead, Mr. Notes.
Well, before I pretty much ate anything I want, anytime I wanted. I didn't really focus on my exercise. Over a period of about 20 years, I gained about a couple pounds a year. Pretty soon, you know, you're 50 pounds overweight, you're obese, you're focused on your career, which, you know, you have a successful career, you know, raising your family, and you're not really thinking about your health. And bad things happen. So some things I found out is that cancer loves sugar. Cancer loves, and this is an obese, inflamed body. I shouldn't say cancer loves sugar, it does, but it really loves an obese, inflamed body. Certain types of cancers, especially those that are, you know, now they're starting to be more and more maybe metabolic related.
Oh, it loves insulin resistance.
It loves, yeah, okay. So thank you. It loves insulin resistance, which if
because
you're
you can
obese,
be insulin resistant without necessarily being obese.
That's true too. In
It's
my
true.
case,
So-
I'm sure I was insulin resistant and obese. So I didn't take care of myself. Now with Liz, it was different.
Yeah, much
she
different.
took care of herself.
Yeah, but I had life factors that kind of fell into place that I think, you know, caused cancer at such an early age. I mean, divorce, change of jobs, new baby, you know, poor dietary choices, poor exercise, just emotional distress, psychological distress, you know, all of those things. And I mean, we all have those things. So I think mine was much more of a stress response that then caused, you know, abnormal cells over a long period of
Dysfunction
time.
in your body. Yeah.
Yeah, absolutely.
Our bodies are affected by our brains, 100%.
Absolutely. And I think not eating well during that time does not help. So, I mean, if there are things that I have changed since cancer diagnoses, it would be, you know, diet changes, a lot less sugar. And the more I've learned about alcohol, the more I've learned, you know, essentially not drinking alcohol. Sorry, we felt like we needed to have a say here.
Yeah.
Decreasing that stress response. So, you know,
Learning to manage stress.
better.
And removing yourself from stressful situations.
Yes.
That cause emotional
Things that do stress you out. Yeah. Removing yourself from those situations. But I think one of the bigger things is honestly prayer. I mean, obviously having cancer, I mean, changed a lot of things, but it also changed the trajectory of my actual work, because that's when I started to go through the whole learning about functional medicine. What is functional medicine? How do we actually get to the root of issues instead of just taking a pill for issues? Like there's we're taking pills for symptoms, we're not actually treating disease.
Right.
And so finding things that actually treat disease. And so, I mean, it led me on a completely different career path, still within medicine, but I mean, completely different. And that, going through that has really opened my eyes to chronic inflammation within the body. Anytime we have chronic inflammation, you're going to end up with abnormal cells. And the main things that we can all do in order to decrease chronic inflammation is, make sure we're eating to keep our gut lining in check, because that is a lot of where our neurotoxins are produced. And how they end up leaking into the body system. And so, changing sugar is the number one, element out there that causes dysbiosis, opening of the endothelial lining inside the intestinal tract for all of those endotoxins to then go throughout the entire body, causing an inflammatory response. So making sure you're eating well, sleeping a lot more, or at least attempting to sleep a lot more. I don't know that I'm real successful at this moment in time. But I mean, trying to actually make sure that you get to bed, at a decent time and sleep at least between 10 p.m. and 2 a.m. So that way you're getting restorative sleep, because that is when your brain is actually dumping all of its neurotoxins that have been produced during the day and cleaning them out of your brain. And so if you're not sleeping during those times, Mom, you're not dumping your neurotoxins. I know. Those of us with sleep dysregulation. No, so I mean, it's, better diet, more exercise, better sleep, better, pretty much just a better relationship with God, because they've done tons of studies that show that even if it's not necessarily fasting and praying, but you are meditating on something for at least 10 minutes twice a day, that it significantly decreases your stress response overall. Your cortisol levels actually decrease, and that whole hormone pathway becomes much more regulated. And those are some of the, huge things that you can do to kind of mitigate your risk of cancer.
Yeah, we're huge believers in fasting and prayer. That's why you have two beautiful little ones hanging around your knees right now.
Exactly right.
Yeah.
So, I guess that's kind of my
I
answer.
can't follow that. That's awesome.
I mean, that's okay.
Well,
there's other
let
things
me give
that
my
you've done.
6 things.
Okay, I want to hear.
I'll give you my top 6 things that I do. Skipping over a lot of stuff, but let me just give this background. So when I got my cancer diagnosis, really Crystal was the one who owned it probably more than me, who did a tremendous amount of research, and she found things like My Cancer Story Rocks, and we found Gene McClellan's group, How to Starve Cancer. There's a lot. Let's just say there's a lot of information in the crowd.
There's a lot.
And I know it's not necessarily double-blind study, but you got a lot of people living life with cancer, and a lot of people have testimonies. So, but Crystal found probably the biggest thing was the idea of a ketogenic diet, and then that led into fasting. Okay, but let me just give my top 6 things. Number 1, pray and sing to God. Read your Bible. And for me, take encouragement in the love of God. And the Bible says that God's love casts out all fear, and I have found that to be true. Because if you get cancer, you're afraid, okay? And the cure for that is to experience God's love, period.
No, that's your foxhole. I mean,
that's it.
There's no atheist in a foxhole. That's your
That's it. You got to go to that place. And I listen to my Toby Mac. I listen to a lot of my songs, and you gotta soldier up, and you gotta buck up. The other thing that happened to me personally, I'll give my 6 things here. That's number 1 is to pray, sing, and read your Bible and pray, and just do all in the love of God. But the biggest thing for me was to take ownership myself for my condition. It wasn't the doctor's fault. It wasn't Crystal's fault, even though I would maybe say stupid things like, well, you make pies all the time. Of course I'm going to eat them and be fat. In other words, it's your fault. It's not my fault. right? That I'm fat. Well, no. It's your fault if you're fat. It's my fault if I'm fat. And we got to take responsibility. So once I took responsibility and I started listening better to her research findings, we started implementing those things, and she did it with me, or I wouldn't have been able to do it. So she sacrificed, but we started doing better. So number one, pray and sing to God. Read your Bible. Dwell on the love of God. Number two, drink lots of clean filtered water every day. Lots of clean filtered water. It's not medical advice, but it used to say drink 8 cups of water every day. I drank probably 12 or 13 cups of water every day, right, for a long time. Filtered water out of our RO or distilled water, or that kind of thing.
Right. You want clean water.
Right. A lot of clean water. Just water. Water. Now I've taken to drinking the sparkling waters when I get hungry, because I try to use that as a meal replacement, and the carbonation kind of helps satisfy my hunger. 8 hours of sleep in a dark room every night. The sleep studies and sleep people say don't have any blue light in there, no white light at all. Make it dark, black. We do have a red colored night light in our room that I guess is okay, but dark. And I take melatonin to sleep.
Yeah, so you take that every single night. So talk to us about how that started.
So the short of it is, I don't remember all the details, is that as Crystal was doing a lot of research, we found out that there were doctors. Look, when you have cancer and they say there's not really much else we can do for you, okay, then you start looking at the medical community. You start looking at, well, dang, I mean, like with me, they could do surgery. Well, we couldn't really do surgery. It's inoperable. We could radiation. We can't really do radiation because we're going to destroy your guts, in your liver and your pancreas and stuff. And 3, we can do chemo, but the chemos don't really work on kidney cancer. Maybe give you 6 months, maybe then another pill. So we thought, well, we need a real solution here.
And you couldn't do cryo either. And you
couldn't do cryo.
But your tumor was also in a bad location for the radiation. It was right next to your aorta and right next to your spine.
Right.
So there's reasons why. So basically, all the conventional medicine were no.
Right.
And when you when you get to the list of all these things that are no, and they're just basically just, well, you have to just wait until it gets worse, and then we.
Yeah. They said wait until it gets worse, and then we'll just address your issues. Right. Well, a tumor on my spine. I'm like, no, when am I going to not walk? Am I going to not? It's like. Right. I've been able to do everything all my life. So anyway, so one of the cancer docs in Nevada, I just remember reading. He had listened to somebody else's research. We listen to TED Talks and read on the internet and stuff. He had found somebody that recommended 180 milligrams of melatonin every night for cancer patients, along with ozone showers and some other things that I don't do. But and so we got on
something easy to implement.
Yeah. So I thought melatonin, that's easy. So I thought, well, and sleep is important. Right. So I started off. I was taking like 20 milligrams of melatonin at night or 10. More than the 3 or 5. And anyway, once I heard about more and more about melatonin and started researching it more, and decided to stop buying the pills because they were too expensive. I just buy the powder now, which one little thing of powder is going to last me my whole life.
Super concentrated.
Yeah. And I measure it with a tiny spoon. 180 milligrams is what they recommended. I kind of just sort of on my own said I'm going to take 120. It's a little less, but it's a lot. But it's a powerful hormone, and it's a powerful hormone that helps your immune system. So all this stuff I'm doing is trying to have an immune system. When I got cancer, and after that, Crystal and I had blood work done, a bunch of blood work that we sent off to get evaluated and stuff. One of the results we got was that I have the immune system of a 90-year-old. Okay, I'm 56 years old, and they tell me I got the immune system of a 90-year-old. Same with Crystal. She maybe have the immune system of an 80-year-old, but still. It wasn't good. So all this stuff to improve your immune system. Recap. Pray and sing to God. Drink lots of clean filtered water. Sleep 8 hours a day. I take a lot of melatonin. I'm kind of groggy in the morning, but I'm used to it now.
It's a huge boost to your immune system.
It's a huge boost to your immune system.
Improve your immune system so that it works correctly, so you don't have cancer cells develop.
Right. And I do a lot of other things for my immune system. That's just one of them. But these top 3 things are for your immune system. 2 other things I do for my immune system. Eat a fresh, clean, mostly vegan diet. So I've been all over the place on this. I've been bad the last probably year. We've been bad last year. Haven't been following our keto diet. But the right keto diet for me is fairly strict. No dairy, maybe a tiny bit of cheese, no grains whatsoever, no sugar or sugar substitutes when I'm doing it right. It's pretty much just cruciferous vegetables. It's sprouts, which I grow myself, my own
You eat a lot of greens.
fresh sprouts. Mushrooms and garlic. I eat the heck out of mushrooms and garlic, and especially black garlic. You know, I like the black fermented garlic, so anything fermented. Fermented foods. If I eat meat, I try to limit it to, just a small amount of meat, chicken or salmon. And this was the biggest lesson learned on keto for me, is that I did the keto for like 6 months and it didn't work. And I'm like, what in the world is going on? I'm eating meat and vegetables. Well, I was eating a lot of meat, and I wasn't eating much fat. And Crystal kept trying to tell me, you have to eat like 70% fat. Good fat. You have to eat some. I'm like, I cannot lose weight eating 70% good fat. I cannot. So
Yeah, because you can't overeat protein and still put on weight.
absolutely. And protein can also feed cancer.
Exactly.
So I said,
Body
okay,
converts it into the fuel
I'm
that
going
it
to
needs.
you get like that 4 to 5 ounces of protein a day. And with kidney cancer in one kidney, you don't need very much protein.
Right.
You do not want to have to process that. So I ate a little bit of meat, a little protein, some vegetables, and now I had to figure out how to get 70% fat in my diet. Well, we did, and once I did, I was eating avocados, we eating,
Olive
MCT
oil
oil,
and-
olive oil, avocado oil, all those things. Keto started working. You got to eat fat to lose weight. It's the craziest thing. I don't know why it works. It works.
That's how you're supposed to
Your
eat.
body needs fat.
Vitamins.
Your brain needs
Yeah.
fat. Yeah.
And two other
Healthy
things.
fats.
Two other things I do. So I guess it's 7 things. Is fasting. The best way to get into ketosis, and which is the state where you want to be pretty much all the time, feeding your body with ketones instead of sugars, is to fast. That is the
Best and fastest way.
that is the best and the cleanest and the fastest way to get into ketosis is fasting, and to get there. And then of course eating properly is good, but fasting. And the story I like about that is this guy was Dan D'Agostino, Dom D'Agostino. He's a researcher, PhD researcher, and he was doing some work for the Navy. And this guy's like a bodybuilder type guy, so he's fit. But Navy SEALs were having seizures when they were on their rebreathers underwater. A rebreather, it cleans up your own air. Anyway, they're on rebreathers. They were having seizures. So he did start doing some research. Anyway, long story short, when they put these guys on a keto diet, they stopped having seizures. They stopped.
Crazy.
And that led him into fasting, because how do you best get into ketosis, right?
Right.
And then that led him into how do you get more out of your workouts, right? And I know Sam's talked about this stuff, about working out in a fasted state. Anyway, just all kinds of good things about fasting and getting into ketosis. So fasting, we've done lots of different kinds of fasts, long fasts, intermittent fasts, and not only does it kind of feel better when you're not so feeling full all the time, but you lose weight, you're healthier. There's just so many benefits you can't even talk about it.
Well, I'm going to back up real quick, because when people listen to this, you're going to hear all those foods that you basically think this is all you eat, and think like that's and so we've been here for a week, and I know that's not all you eat, and so but I understand
But that's ideal.
That's your ideal diet.
That's right.
But there
When you
are
feel the best.
you don't.
Yeah.
But if you want to have, because I know Breanne made pie, if you want to have pie, Crystal makes pie.
I've eaten it.
We eat it, and so it's not like this is like Tim's ideal diet, but Tim can deviate from this diet anytime he wants,
And I do.
and then get back to it,
Right.
Or that's his goal diet, and get back to it, and then
That's
fast.
Right. That's right.
So, and the quickest kind of way to especially when you're not eating your ideal diet, you're eating all the terrible stuff when your family's around, because that's what we do, is to kind of you can get fast and reset to that quicker.
That's right.
Yeah.
So yeah, thanks, Sam. I want to be clear on that. But I'll tell you, when you got an inoperable tumor, okay, you're going to have the discipline. Well, I hope you do.
You have the motivation.
You got the motivation and the discipline to eat super clean, and that's my super clean diet. Right? I don't do that all the time, obviously.
Right, but you also need to know that the issue with the American diet is people try to eat less and exercise more, and it doesn't work, and so they basically say, well, what's the point?
Yeah.
And so recognizing that there is a successful way to do it, that doesn't destroy your life, and you're still able to, when you want to have it, have the pies and that kind of stuff. And so then you're like, well, I'm choosing not to do it because it's going to make you feel good.
Right.
Yeah.
Right.
No, I found that the fasting, intermittent fasting, and eating clean, basically eating clean, and when for me eating clean is, of course, none of the packaged foods and sugars and the high carb stuff, but it's basically a keto diet. Now, yes, I'll add in some fresh fruit. Yes, I'll add in some nuts and berries. Yes, so you add those things in there, but I'm just saying there is kind of a core diet of cruciferous vegetables and fat and limited protein that would be, like the ideal.
Right. It's beneficial.
Right. So fasting, eating clean, fasting. And then the last thing, this was interesting because I was overseas at a clinic that did some different kinds of holistic treatments for cancer patients. And one of the things they did was I went through some whole body hyperthermia and some local hyperthermia treatment where they heat your body up, right? So they heat your body up to like 100 and maybe 3 to 4 degrees, Fahrenheit. I try to hold it there for an hour. I think the most they ever got me up to was like 102.8 or something like that. But just hold it there for a while. And then the idea is that it's an immune system stimulator. Because the cancer doctor, professor that ran this clinic over there, he asked me one time, he says, hey, when you get sick, with a cold or flu, do you ever get a fever, really? And I said, no, never get a fever. I haven't had a fever in years. He said, okay. I said, why? He said, well, maybe there's a correlation, that people that really rarely get fevers have a higher incidence of cancer. I said, well, what do you mean? He says, well, heating your body up, whether you're just laying out in the sun on the beach, or whether you're working out and getting up a good sweat, or whether you're soaking 30 to 40 minutes in a hot tub as hot as you can stand, or sitting for 45, 50 minutes in a hot sauna, and getting your body, heating your body up, stimulates your immune system.
Oh, it's what your body does when you get sick. It heats your fever heats up your body.
That's right.
It's an immune response.
That's right.
And you're trying to use that to attack the bacteria that's growing at the normal body temperature.
And when I was over there, and I had this tumor, in my back. I would lay on this table, and they'd put this deal on my back. It felt like a bag of water or whatever they put on there. Anyway, it was putting energy or heat into my back there. And I can't remember the temperature, but if you heat up a cancer tumor enough, you can kill it, and you can certainly disrupt its reproductive functions and the cell signaling functions, like that. So I have a sauna here. I try to sit in it a couple times a week, not for any other reason, just to stimulate my immune system. And the other thing it does is it would obviously, what do you call that? Your lymphatic system. Yeah. Sweating is good for your, cleaning out your lymph nodes and all that stuff. Help you detox. So that's really. Those are my main things. Oh, and then last, I guess, is just exercising for me. That's just walking like 30 to 60 minutes a day. Try to walk at a brisk pace, and try to do it maybe half hour after I eat, sometime 20 minutes, because what I'm trying to do is when I eat, my blood sugar will peak. Everybody's does after you eat. Your blood sugar will peak, and but if you walk not too long after you eat, that walking helps reduce that peak. Which
the spike.
You start to utilize it.
Yeah, because you're using it. So it's those big spikes and long spikes where your blood sugar is high that creates the insulin and the insulin resistance and all that stuff Liz was talking about.
Mm-hmm. Yep.
So if you eat, that's like don't eat all day long. If you're going to eat, have a meal, stop, go 4 or 5 hours, have your next meal, stop. Kind of thing. But just eating from 7 in the morning till 10 at night.
Snacking, constantly keeping your insulin high, constantly telling your body to store fat.
It's bad. Yeah. And I'll let you guys say why, because the immune system needs a rest. But that's my spiel.
So, Mom, you've done all this research. You guys have changed all the things. Dad has his list of things. What are some of the big things for you? What are the changes that you've made? What are the mindset things that have changed for you since the cancer?
That it's okay not to eat.
Yeah. That is huge. That's huge. I mean, yeah.
What?
I love the way you just state that because it's so counterintuitive to everything that we're taught.
We're going to die if we don't eat.
Well, we were just told for so long that we need 3 meals a day.
Plus snacks.
And breakfast is the most important meal of the day.
Not true.
Yeah, just different things like that. And so seeing this Dom D'Agostino talk about the different ways of fasting and intermittent fasting and how he did it or how other people do it. And I've never been a very big breakfast eater anyway, and so that's the easy time for me to just not eat, and just I can typically make it until 2 o'clock. If I start getting hungry at 2, then I do like Tim, and I have one of those little carbonated drinks. And I don't drink all of it, just some of it, but it's just enough to take the edge off. And then I keep myself busy doing other things so that I don't think about it. Pretty soon it's 4 o'clock, and I yet have a window from like 4 to 7 that I eat. And it's nice that my stomach has shrunk down so much that I don't feel like I have to eat so much of everything. In fact, I had to have him stop filling my plate because he fills it for his size, and I just don't need that much. And yet I'm still functioning and working well, just eating during that window.
So many people that I talk to who are incredibly healthy and love how they're feeling do OMADs, just like that, 1 meal a day, or just a small eating window. They just eat once a day, and they love how well it works for them and how much healthier they feel. And personally, I like that too, because I'm the same way. Like, I can fast until 2 o'clock-ish, no problem. Then I start getting a little hungry, so I'll do a little fasting food of some sort, and then
a couple macadamia nuts.
Something like that, or a sparkling water, whatever.
But
and
the fact that you guys get past
great.
that, both of you get past that, shows that it was not actual hunger; it was just a hormone response because of it.
That's what your body's used to normally eating.
Yeah, so that hormone ghrelin gets spiked and sends it out and says, "Okay, eat," and you're like, "Well, if I do this," and then 45 minutes later, if I'm not hungry, then it's just a hormone response. Because really, a few macadamia nuts or some seltzer water really wouldn't satiate you if you were actually hungry.
Right. True. Yeah.
Well, years ago I had my gallbladder removed, and one of the things they told me is that if I had not been missing meals, if I'd just been eating like the American diet says, that I wouldn't have had to have my gallbladder taken out because it was storing up bile, and that's why I had gallstones and all that. And really it was a metabolic response to other things. Now that, 20 years later. But those are issues that you have to deal with now as you get older. Didn't notice it so much, in my 40s and 50s, but now I do. It's affected that, and now the thyroid doesn't work as well, just lots of different things. So if you can keep your gallbladder, by taking care of yourself when you're younger, more power to you, and just do it. And it doesn't have anything to do with you missing a few meals when you're young. You can do it.
Yeah. Exactly.
Well, plus the obesity epidemic just keeps getting worse and worse and worse. And so rather than recognizing maybe we were doing something wrong and maybe the advice we're giving is not correct, we're just digging in deeper and deeper and saying, nope, if we can't, even though the data says that this fails 99% of the time, we're still going to push it. And then every single state has an obesity problem now. And so recognize that maybe the advice, fat was the enemy, right? Eisenhower had a heart attack, and so then they started saying, well, it's either sugar or fat, and the sugar industry pushed that fat was the problem. And so we took natural occurring fats out of our diet, and we've done that for...
Replaced it with sugar. And now look where we are.
And we've done that and then we started telling people you got to eat 6 times a day, and you should never stop eating.
All these little tiny small meals.
Yeah, you should never stop eating. Basically, which means you should always keep your insulin elevated, and you should always and that's why we get insulin resistance, and insulin resistance causes all kinds of problems.
Right.
Not only just diabetes, but low testosterone in men, which actually low testosterone in men increases mortality. Alzheimer's disease, which some
the low testosterone causes then cardiac issues also.
Cardiac issues, and so this huge thing of metabolic syndromes that happens because we're always eating all the time, because insulin resistance leads to all these things. High cholesterol. So then when we start to see people take fast, now they're actually recommending physicians or healthcare providers to actually move prescribing fasting to patients because of all these benefits that are not only for the brain, but for the gut, for the muscles. Your body actually preserves your muscle mass. It's actually your fat has a purpose, and the purpose is one, to use as energy, and two, when you go into that ketosis state. The reason why you get to ketosis fastest when you fast is because if you're eating, even if you're eating ketogenic, you're still getting nutrients from your environment. And so it's going to take more time. It's going to process those things first. Like when we're getting this, we're using our fat as a stored energy reserve. So fasting gets you there the fastest. But then you can maintain it even when the food that you eat when you're off. But you don't have to actually eat a ketogenic diet all the time. None of us do.
Right.
We all, even though Liz isn't here right now, because we all fast differently. We all fast for our own personal body types. And so what isn't successful for me is fasting exactly what Crystal does, but wouldn't be successful for her be fasting the same way I do. And that's why we developed flexible fasting, is because it's flexible to each individual person. And here you have people of all different age groups, different sexes, and are being successful with flexible fasting because they're utilizing it the way their body's supposed to utilize it. So
Let me add one more thing. When I came back from overseas, and I had really been intensely following my steps here, doing everything, eating clean, doing my intermittent fasting, flexible fasting, sleeping, exercising, doing all of this stuff. And I'd lost weight, and I was down, at a good weight, pretty a lower weight for me. It hadn't been in for a long time. But I had blood work done when I came back after all that. And normally, my condition before was, metabolic syndrome, right? High triglycerides, fatty liver, blood sugar was 90, 92, 95, cholesterol was mostly bad cholesterol.
high blood pressure.
Blood pressure was it's never been horrible. It was, 150, 140 over 90, type thing, right? So, that was my before. And then because I had a kidney removed, previously, my creatinine and my BUN.
But previously because of cancer.
Because of cancer.
Yeah.
My creatinine, my BUN, and a couple other things, but they were out of spec, okay,
Right.
because I had one kidney, right? And the doctor said, hey, it's no problem. It's like you're in like a first stage kidney failure, kidney disease. It's not terrible. You can live like that, Well, anyway, was doing all this stuff. I'd lost weight. I was exercising consistently, eating clean, drinking the water, doing all this stuff.
And
I
fasting.
got my blood, and fasting, I got my blood work back. And there was not one thing out of spec. Not one. For the first time in like 6 years after having my kidney out, my creatinine and my BUN were well within the normal range with one kidney. I couldn't believe it. All my other markers were in normal ranges. So, I'm telling you, it works. That was the best blood work I'd had in 20 years. And I had 2 kidneys before that,
Yeah.
before.
That's
Right?
true.
But with one kidney. That's how well this works if you're disciplined. I'm not that disciplined all the time, and Sam's talking about that with, the flexibility. But when you are disciplined and you stick to it, I can
Huge
tell
benefits, huge results.
it works.
And you can always go back to it. But
That's right.
you had mentioned how you eat, and you mentioned like one of your fasting fuels was like the seltzer water, some activity. So like, what do you have a certain diet regimen that you try to also follow when you eat?
No, no, I'm just busy during the day, so I have little things, like I've made little fat bombs before, like with pepperoni and cream cheese, little things like that I can just pop in my mouth and say, okay, that satiates it. Or a few macadamia nuts, not very many, 2 or 3, and a little seltzer water, and I'm good. But that's only if I'm really, really feeling hungry. Most of the time I can make it, it's just a little bit of discipline in the mind. And it's usually the first day that I start, like, okay, we got to get back on the bandwagon here and help ourselves feel better. And the first day is probably typically the hardest. After that, it's 2 or 3, 4 days down the road, it's no problem, missing a meal. And then sometimes to skip that meal altogether and, make it till 2 o'clock the next day, what you would say would be a 36-hour fast, that kind of thing. It's easier to do. One of the things I want to bring up, though, is that people that are going through cancer treatments, they did find out that if they fasted for 3 days before they would go in for their chemotherapy, it protected their body instead of the chemo drug affecting the whole body. It affected just the cancer only, and the body went into protection mode. So that's kind of a big deal when you're going through chemotherapy.
It is a really big deal, especially because your digestive system shuts down because you're not using it, and so that is more protected. and you don't have as many of those horrible symptoms that people will have with the nausea, vomiting, mouth sores, like all those kind of things, side effects from the chemotherapy.
Greatly reduces side effects.
It reduces side effects so much to fast before chemo treatments. That is a big deal.
And the thing is, typically they're telling you, now, you're going to feel nauseated when you have these chemo treatments. So you need to keep your eating up and, eat things that, help you feel better. Saltine crackers, juice, whatever it is.
Yeah,
and it's
that'll probably make it worse.
Yeah, and it's really, those are the things that you need to ignore and just listen to your body and let it fast and, be able to recover much quicker.
Right.
Well, and some of the researchers, there are researchers actually supporting that exact thing now that are now saying, look, what Chris started pointing out, trying to encourage oncologists to say what the chemo drug is supposed to do is supposed to attack rapidly dividing cells, and rapidly dividing cells are hair and your gut and your nails and things in your mouth. And so if you can shut those down so they're not actively being used, not rapidly dividing, then the only thing that's rapidly dividing is the cancer. And so
that gets absorbed more by the cancer cells.
Well, yeah, so it attacks cancer cells even more readily, and then also those other cells don't get attacked as hard, so you can protect yourself that way. But when you do eat, so you've got mentioned your fasting pills. What do you eat when you do eat? What's your diet of choice?
My diet of choice is I love steamed broccoli with lots of butter on it, and I don't mind having a little bit of refined coconut oil. I don't care for the taste of coconut on everything, so I use the refined coconut oil. We do cook with that. And broccoli, baked cauliflower. I even do Brussels sprouts once in a while. I love kale salads that have stuff cut up in it. I make my own salad dressing just by grinding up in a little blender my own just oils, avocado oil, capers, the little tiny fish.
Anchovies.
Is it anchovies? Anyway, you grind them all up. You don't know that you're eating them, but I happen to really love Caesar salad dressing, and that's what they put. That's what they put in there.
I love Caesar salad dressing.
Yeah, Parmesan cheese, and I like the fact that even if you put a kale salad back in the refrigerator, if I put something on it and I couldn't eat all of it, it still has, it hasn't gone limp. It still has a little texture.
Crunchy.
Yeah, kale holds its
texture.
shape a lot better. Stands up to leftovers.
But we
better.
eat a small amount of meat typically with the evening meal.
Yeah, Tim and I would split a chicken breast. Sometimes we just eat a few slices to put on a salad, and then like a whole chicken breast would be 2 meals for us, that kind of thing. I will say though that I did, when he came back from Germany, we instituted getting the sauna, so we were making sure that and we have 2 different types of sauna out there that he does use, but I went on a vegetable-only diet with him for that 30 days so that he would have a liver cleanse at the same time. And that was a little bit different because if you're doing kind of a keto lifestyle for cancer, and then you can only eat certain types of high fiber vegetables, that it was very limiting, and it got old over 30 days. That was a tough thing to do, but it was for only 30 days, so we stuck with it. But it was, like I said, it was mostly Brussels sprouts, all these high cruciferous things that are.
Did you feel better after the 30 days of doing a liver
Felt the same because we had already been doing that.
Felt great. I felt great, and that's when I went and got the blood work done. And I will add that one more thing for the guys is that. So after I had that blood work done, I went and saw a functional medicine oncologist down in Florida, and he was looking at my blood work, and he says, well, I expected to put you on a testosterone supplement because he gave me some things for improved brain function and prebiotics and probiotics and a bunch of things, but he says your testosterone's 800. I said, is that normal? He said, well, mine's 400. I said, okay, you're a slacker, But he said no. He said for your situation, he said that's excellent. Most guys your age, come in, like me, 'cause he's the same age as me. We're around 400, maybe 500, 300. And he said most guys, I can put on a little bit of a testosterone supplement. So, all this stuff just helps. It's just one more marker that says, hey, you're being healthy.
Yeah. Well, low testosterone is a sign of insulin resistance. Insulin resistance.
Oh,
causes
I didn't know that.
Yeah, insulin resistance causes low testosterone. So if you can beat insulin resistance with fasting,
So I must have been beating the insulin resistance big time.
Yep.
Yeah, with fasting.
Yep.
Yeah, your blood work proved that.
Yeah.
Yeah.
And it's getting worse.
I
and
didn't
worse.
know that was related.
Yeah, it's getting. It's another thing. It's getting worse. It's getting worse and worse. You know, it's now becoming a common problem because of the diet that we're eating.
Yeah.
You know?
Right. Right.
I'd say it isn't just the diet that we're eating, it's all the things that we're being prescribed to help the little things that we think we need help with.
All the band-aids.
Well, yeah, Liz had
Yeah.
mentioned that. Like
Yeah.
we're treating the symptoms, not the cause. You know.
Which is a problem.
Well, yeah, I might mention that for the last, ever since I've had my cancer diagnosis, I haven't been on any really prescription medicines. I take a calcitrol just because I have one kidney for my parathyroid, a tiny little bit. But I mean,
Sure.
I've had no blood pressure medicine, no nothing.
Yeah.
And so, I mean, you can live without it and do okay. Now, I do take a lot of very specific supplements, and I would just offer this: if you have cancer, I won't say his name. There's a couple guys in Florida that I think are good, but what I did is I had a bunch of blood work done. Those guys will do a whole bunch of blood work that your oncologist won't do. Because the oncologist is there to do three things. He's there to prescribe chemo, he's there to do surgery, or he's there to do radiation. I mean, and that's what they do. And that's okay. But if you want something beyond that, you go to the functional medicine guy. They do a full blood panel and go into gory detail. Like my vitamin D level was X. It was in the normal range. He said, now for cancer, I want it 2 times what it is now. So you need to take this much vitamin D, and here's the vitamin D I want you to take. And he went through every single thing, and I probably take 15 supplements a day. Okay, based on my blood work, which I need to go get another new set, and then readjust. So it's not just go out and take a bunch of supplements. It's get the blood work, find out what you've got, get expert advice on what you need to address, and then supplement to address those things.
Yeah. So see how it works in your body and then adjust it. Yeah.
Right, but it's best to do the blood work. I know it costs money. Okay, it cost me like $1,000 or whatever, but I'm telling you what,
Well, it costs you money or it costs you health if you don't.
That's right.
And then when your health goes down, then you pay for that cost long term.
That's right.
So I mean, it is an upfront cost, but also long
Dude,
term.
I can save that much money fasting and eating clean.
Yeah.
In a year.
That's true.
Yeah.
Easily.
So are
no
you
burgers.
are you still on medications or?
I have to take thyroid.
All right. Did you used to take blood pressure pills too, though? Okay.
Nope.
It's great.
So
I don't really take much. I take a little bit of pain medication a couple times a week just for joint pain, but that's my age and I don't have a lot of cartilage left.
Sure.
So yeah, normal stuff.
I will make one more plug for people that have cancer. I mean, I found Jane McClellan's book, How to Starve Cancer Without Starving Yourself, a very good, intelligent, well-researched approach to, if you're like me and there weren't really any options, you're willing to try some things. And she talks about how to kill cancer cells. And she talks about, two things. She talks about how to keep cancer stem cells from reproducing. And then she talks about how to kill cancer cells. And even though I'm trusting God for my healing, I wanted to do what I could to make myself healthy, right? I mean, God feeds a sparrow, but he doesn't put the food in their nest, kind of thing. So I like the idea of arming myself with information, everything Crystal found out, and then we found her book, but how to keep cancer cells from signaling and communicating within themselves so they can do their bad cancer thing, how to keep stem cells from growing, how to block them from the foods or the stuff they need to grow, the 17, 18, whatever, 19 pathways it was for that to happen, and then how to try to kill cancer cells. So anyway, maybe it was it just gave me something to do, but I've read that a couple times and highlighted it, and I found it to be helpful. So.
People need resources.
Yeah, and that's just one resource. I'm sure there's a lot of them.
I would say be brave. Give it a go. Give it a try.
Yeah.
Don't tell yourself you can't do it. You can't make it. You can do it. Even if it's just 1 hour that first day, if you can make it 2 hours past the next day,
For fasting, you mean?
for fasting.
Yeah.
Yeah,
Yeah, just take increments,
just be
baby
brave
steps.
and tell yourself you can do it.
Exactly.
And I'll tell cancer people, I mean, I went to MD Anderson in Texas. I've been to all these cancer places, and they're, we're just lined up patients. And I'm talking to people that have been living with cancer for 20 years, 30 years, 40 years, that go in for routine checkups, So I would just say that cancer is not a death sentence necessarily. And never, never, never give up hope. Never give up hope and take responsibility. Do what you can.
Yeah.
And ask God to do the rest.
Absolutely.
We all need to do that for our health. Not just if you have cancer, but we all need to take responsibility for our own health.
Yeah.
So it doesn't rest with anyone else. So anyway, thank you so much all for being here, and hopefully y'all found this helpful. I hope you'll listen to it a few times over and just glean all those nuggets out of there. And we're praying that this is a blessing to you, and that you will take charge of your health and be all that you can be. Thanks for listening.